Hello everyone, welcome again to Dr. Green's TV. Today we shall be continuing with our discourse on why are my breasts producing excessive water. The last time we talked about the condition that when a woman is not pregnant or not nursing a baby and finds her breast releasing fluid, releasing water, it's an abnormal condition. These conditions can lead to abnormal menses and consequently may lead to infertility. Now, what are the causes of this condition of hyperprolactin in the body? Remember that the last time we mentioned what prolactin is. Prolactin is a chemical in your body, a hormone that is responsible for preparing the breast to release breast milk. Now, when you are pregnant, this prolactin is released in high level, and immediately after delivery, at term, the prolactin will enable your breast to release milk normally. But when you are not pregnant and you are not nursing a baby and you notice that your breasts are releasing milk, that means that the prolactin is abnormally high, and this is a disease condition. Now, what are the conditions that can lead to this? Number one is a growth in the brain called tumor or adenoma. This tumor can be of large size or small size. And if you notice that you're having this condition and you feel headache or you have double vision, that is, as you are looking at something, it will be double in your eyes. This could be pointing to the fact that you may have a brain tumor and you need to be investigated for that. In the last video, we mentioned how the test can be done to detect this. Another condition that can lead to this increased prolactin level includes stress, excessive stress, physical stress, emotional stress. So if you find this situation and you see that you are usually or always involved in stress, then you need to check it. Another one is drug, some medications. For instance, those ones that are used for the treatment of catarrh or used by asthmatics that are called histamine blockers. Such drugs can lead to this condition, causing increased prolactin in the body and giving you this hyperprolactinemia. Other things that can as well cause this include exercise. People that are engaged in exercise, like sports women, can have this condition as well. So if you notice you're having this release of excessive breast milk and you are a sports lady, engaging in football, engaging in athletics, or all other kinds of sports, then you can watch it. Other things can also be things like nipple stimulation. Nipple stimulation is one of the mechanisms that the baby, for instance, when immediately after delivery, the baby is put to breast, the nipple, immediately the baby starts suckling, it stimulates the nipple. So other forms of nipple stimulation, rubbing the nipples and all manner of manipulations on the nipple can as well trigger this stimulation and lead to excessive prolactin. Now, when this prolactin has been increased and it will lead to this situation, what are the other effects of this hyperprolactinemia? When it is elevated like this, apart from you having breast milk release abnormally in the breast, it can lead to amenorrhea, that is, not seeing your menses as at when due. You may notice that you miss your period, you are not pregnant, your period is not coming, your menses is not coming. So when this lasts for up to 6 months, it is usually called amenorrhea. But if it is less than 6 months, it can be called scanty or oligomenorrhea. So this could be as a result of excessive release of prolactin. It can also lead to you not ovulating, and it can as well lead to inability to conceive. So these are some of the things. Now I want to also let you know that this condition is not only restricted to women, it can as well affect men. And in men, it will lead to erectile dysfunction, low libido. The man will not crave for women. The man will have less desire for sex. Then it can also lead to enlargement of the breast in a man. The man's breast will grow unnecessarily bigger than the normal male breast. So, other effects of increased prolactin will include things like headache, weight gain, reduced libido, visual abnormality, and acne, that is, pimples. So, have you found these things happening to you? Then it means that most likely the level of prolactin in your body has been more than normal. And in that case, you need to be investigated. You need to be tested. You need to be assessed medically to be able to find actually what the problem is and what is causing this. The good news about this is that once it is detected that it is hyperprolactinemia that is causing your problem, there is treatment for it, and a simple treatment for that matter. So in the next video, we shall be telling you the things to do to treat this condition. But most importantly, you know that you need to see your doctor to be well guided. Thank you very much. Continue to follow us as we work hard to give you more inciting, more enlightening, and more interesting information. Feel free to ask your questions. We'll be glad to answer your questions in other videos. Thank you very much for watching. Goodbye.